Hi, my name's Caitlin. I'm the esthetician here at Dr. Atagi's. Today I'm going to be talking about microneedling, and I have a friend here who's going to be demoing, who I'm going to be demoing on. I've already done half of her face, so you can see that she's a little bit pink on the right side, and I'm going to be demoing on the left side. I've got my pink gloves, my pink hat, so feeling sassy and ready to go. We have a new pen device for microneedling. We originally started off with the Skin Pen 2, and we have upgraded to the Skin Pen Precision. With the Skin Pen Precision, it has 2 extra stainless steel needles, so it's 14 in total. The calibration is a little bit faster, so it pulses in and out of the skin at a rapid rate, creating all these little microchannels in the skin. So what this does is it creates little tiny microscopic holes so that our natural collagen can build into those areas. So it's going to help fill in fine lines, wrinkles. It breaks up pigmented areas with those little needles. It's really good for acne scars. It's my favorite to treat for acne scars. The needle can break up the scar tissue and it replaces it with all that good collagen, the way your skin should have healed originally, for a much softer, even-toned skin. So prior to the treatment, you want to make sure that you do not take blood thinners the day before and the day of. This includes ibuprofen, aspirin, baby aspirin, fish oil, things like that. You also want to make sure that you stop Retin-A 3 days prior to the treatment, glycolic, salicylics, and benzoyl peroxides. The downtime for this treatment is about 2 days, so you're nice and red for about 24 to 48 hours. After that, the redness completely subsides. Sometimes with my clients, you can get a little bit peely in this area mainly, sometimes flaky in the rest of your face too, over about day 3 to 5. That will determine, determine how much peeling you get by the health of your skin. So I can sort of determine how much peeling you're going to have when you tell me whether you've been using active ingredients and taking care of your skin with Retin-A's. Have you had treatments in the past? Have you been in the sun recently? Those will all help me determine better estimate of how much you're going to peel for the treatment. Some people don't even peel, so the downtime of the next day, you can pretty much just apply makeup. You cover up all that redness, there's no irritation. Here at Atagi's, we recommend a series of 3. With the series of 3, you do get a full-size post-care procedure that you can take home with you and you use from day 3 to 5. When your skin is completely healed after that, you can go back to using your Retin-A's, vitamin C's, any of those good active ingredients that I always encourage people to be using while doing a treatment like that. Because that's going to be your at-home maintenance. You want to make sure that you're maintaining your skin, you're protecting it with sunscreen, you're building up the strength for maybe more aggressive treatments in the future. One of the more aggressive treatments I like to do is I like to include a chemical peel on top of the treatment as well. I won't be doing that today, however, we will be doing a seminar April 26th that you can keep updated by our Facebook. We'll post it on there. It's good for all skin types, so anybody can do it. Rosacea, acneic, darker skin tones, pigmented skin tones, older skin types. There's no negative side effect to doing microneedling. You can do it once a month if you wanted to, for 6 months in a row. It's just going to only strengthen your skin and give you better results. So I'm going to begin on her left side here. I'm going to start in the cheek area, the nice fleshy area, and I use a saline solution here on my gauze as a little bit of a slip, so I apply it to the skin. And then this needle cartridge I can adjust up and down like this. So I treat different areas with different depths. In the fleshier areas such as the cheekbone, I'm going to go a little bit deeper. If she isn't like any scarring, I'll go a little bit deeper in the scarring. Upper lip and forehead tend to be a little bit more tender, but really not all that uncomfortable. The whole treatment is pretty a comfortable treatment. And you do numb topically 30 minutes prior to the treatment. So I'm going to get started here, and I'm going to adjust it to a 1.5 millimeters. I've worked on her skin before, so I know that I can go a little bit deeper.
Feel uncomfortable?
So you can see she got nice and pink, a little bit of pinpoint bleeding. That's all the good blood cells rushing to the surface to heal the skin. So all that inflammation and erythema of the skin is going to help stir up that collagen to help soften fine lines. So at this point, I'm going to adjust the pen and not go quite as deep around the under eye, the thin skin, and the upper lip, which is also thin, and then we'll finish up with the nose and the forehead. Okay, so at this point I could choose to do a few more passes or just let her skin be as is, or I can even choose to put a chemical peel solution on top of that. But we're gonna stop there, and I think she's looking nice and red. And so this is truly one of my favorite treatments. For the amount of results that you get, for the results that people are getting, and the little downtime, people have been responding really well and really enjoying it. So at this point, if you have any questions, I am happy to answer.
I have a question for our friend in our hot seat. Getting the treatment, what is it painful?
It really isn't. The numbing cream that gets put on before helps a lot. It just feels like if you had a pencil just kind of lightly running it across your face. It's not more than that. When you do your nose, that is the only part that's ticklish. It doesn't hurt, but it's ticklish.
Yeah, sometimes people around the nose area, because of the vibration, it doesn't hurt, but it does sort of give that tickling sensation that makes you want to sneeze, which is completely normal.
Yeah, other than that, it does not hurt at all.
And I'm darker complexion. Would you recommend for somebody like myself to come in and have a consult prior to getting treated?
Yeah, so if you've never been treated for a treatment like this before, I would like to consult with you prior to it, whether it's a phone consult, but just to go over what you're doing in skincare, what skin tone you are. If you're darker complexion, it's nice to pre-treat with a hydroquinone, 4%, which is physician grade. This is going to lighten that pigment, and it's also going to prevent any post-inflammatory pigmentation, and that could be pigment that comes to the surface from either more aggressive treatments or heat.
And recovery time is the same for everyone?
So again, depending upon the health of your skin, have you had treatments in the past? Have you been treating with a Retin-A? Have you been in the sun? Will determine the length of the healing time. Typically it's going to be about 2 days of redness, 3 to 5 days of dryness, flakiness, and then after that your skin pretty much goes back to normal. But with the more damaged skin, it can take up to about 7 days. You might have a little bit more dead skin cells on the surface that we just need to completely get rid of, which is a good thing. That's going to be resurfacing.
Well, this is fun. I can't wait to have my treatment soon.
Thank you.
Thank you, Caitlin, and thank you to our friend who came in today to help us.
Thank you.